Good morning, everybody. Welcome to our show on coronavirus. This morning, we are talking about children back to school and coronavirus. How does it feel, sending your children back to school during this time of COVID-19? Um, your host, myself, is Modo Vuga, and in the panel we have uh, Ferdinand Dali. He is a research scientist and his interest is in wound healing. We have Benjamin. He is a teacher in Sheffield. He's a secondary school teacher and he is a guest. Um, he is a guest this morning. And we have Ferdinand Lally. He's also part of the community in Sheffield. Welcome to all of you. We're going to start with a short prayer. Let's pray together. God, Heavenly Father, we thank you very much for being with us. We thank you for this morning. We ask you to be with us in everything that we say. This morning, we know this will help somebody out there. And we ask you to guide our thoughts, to guide our thoughts. And Father, bless us this morning and bless everybody out there. In Jesus' name I pray. Amen. Okay, without wasting too much time, we are going to start our show. And as I introduced it earlier, it is about going back to school and coronavirus. So I'm going to ask our teacher, Mr. Benjamin Taban, to tell us how it feels now that children have to go back to school and there are a lot of measures that have to be taken. There's the social distancing, there's the hand washing, there's the, how would that impact your work as a teacher and how does it feel? Thank you so much. Go ahead, please, Mr. Benjamin.
Thanks, Modo, for inviting me here today. I have to confess, I know, I know very, very, very little about the virus, coronavirus, COVID-19. I know very little about it. I'm not going to talk about the virus itself, but I'm going to talk about how we live with it. Living with the virus, what I mean there is how do we lead our life in the midst of this virus? Because we've got to go to work, people have got to go to work, children are going to go back to school, and teachers are going to go back to school to teach. Now, what I'll start with is how the everyday today life in a school setting goes. First, in a normal circumstance without the COVID-19, a typical classroom setting in a school, secondary school in particular, is where we have a classroom setting in science department like my own, where I teach. We teach in a laboratories. Laboratories are designed in such a way that there are sinks on each table. There might be two sinks depending on the size of the table. Or if it is a small table, you've got one sink. And on the side of the room, you might have about 4 sinks from one corner to the other. So the whole class also is set up with gas where children do experiments. and there are 2 gas tubes per each table on one side and 2 on the other side. So a typical table where there are four students, you will have about 4 gas tubes, 2 on the other side and 2 on this side. Now, this in terms of social distancing is not quite 2 meters apart. It's going to be probably about a meter or less than a meter apart, depending on the positioning of the students and the gas tubes. If the gas tubes are shorter, it means the distance between one student and the other one is going to be less than a meter. Now, this is a typical one. Now, in the current situation where you will have a social distancing of 2 meters, it means there would be only 2 students per table. That in total means out of the 28 students in a class, you will only have 14 students in a class. So where are you going to put the other 14? If you've got children of 26, that means 13 each. You know, so where are you going to put the other 13? In some classes, there are about 30 students, depending on the ability group. The high ability group are usually 30. So that is 15 each. So it's going to be very difficult for children to carry on with laboratory activities because of the social distancing policy. Now, if there are only half of a class supposed to be in a lab, where are we going to put the other half? So in a typical department, you have about 6 science labs. So that's 6 science labs, or let's say 4, depending on the size of the school, or 8, depending on the size of the school. If that is the case, how are we going to accommodate all these students in a day? I think there is a big challenge there, very big challenge. That might mean, if that is the case, we have to divide the day of the school into 2. Maybe some students go in the morning up to lunchtime or 2 o'clock, and then the others enter at 2 and finish at around 6. Now,
Benjamin, can I
yeah,
interrupt you a bit? Because that's right, you know, in the lab already, but even in the school setting, welcoming of the students, you know, there is usually an assembly, you know, when my son went to school. So on some days there is assembly, and then there is the dining room where, you know, students come to dine, and then there's the playground and the classroom as well. The teacher comes to check the work of the students or the pupils. You know, how would that one work?
well, that's what I'm trying to explain, starting from my starting from the everyday business. Yeah, the classroom setting is a must. It has to happen. Assemblies happen sometimes, happen sometimes once a week. It depends on the school, and that can be arranged. You know, you can bring people. I mean, assemblies depending on the size of the assembly. I will come to that one. Yeah. So my point there is, in a classroom setting where I've got very good knowledge of in the lab, it's going to be a challenge. It can be done within a smaller groups, but to do that for the whole number of students might mean that you have to use the school has to start early and finish late, so that you can have two streams of students. Some learn in the morning, some learn in the evening. That might have implication for childcare at home as well. So that's the difficulties. In assembly setting, assembly can be organized. You can run assembly every day if they want to, according to the number of children that can be accommodated within the 2 meters social distancing policy. That can be done. But it means that you'll have to run the assembly of 1 hour throughout the day and another day as well. So that can be organized. In the dining, of course, in the dining, it can be done. So again, it will mean if you divide the streams into two, the sessions, morning session and evening session, then that will reduce the number of people going for lunch in the dining hall. So that will help. But in the playground, some schools have limited play areas. Some have got bigger play areas. And then also classrooms can be organized to accommodate some children to play within the building, just to minimize the number of people getting closer together. I think administration can organize that one. The main problem is, how are you going to police the children? Children, you can imagine some children have got behavioral issues. They are going to take advantage of disrupting the system that has been created. That we can't rule that out. But
Yeah.
of course, if there are teachers around supervising all the time, then that can be minimized. But again, that would mean you take the teacher away, some teachers away from their duties of preparing lessons or marking, assessment, and all that. So it will take them away from some of the administrative work and some of the day-to-day work. So the main thing is the teaching part of it. It's going to be very difficult, and I don't know how that can be resolved, and that has got a big implication on the resource. Usually children share resources, and now if everybody has got to use their resources alone, that will have a strain on the school resources. And I can understand the government may not have enough money to provide for all the schools at that capacity, and that means learning might be very seriously affected. And I can't tell, but I can see how
Thank
it's going
you.
to be.
Benjamin, we'll come back to you. Let's find out. Nani, you've got children, as a parent, you'll be sending your children back to school in September. And here is our teacher explaining the difficulties they will face. Now the children have to go out to school, maybe with masks on their faces, and constantly they should be washing their hands. Me as a parent, I was telling my son, you might not be able to make friends, because how do you make friends? There's this social distancing. How do you come closer to a person to make friendship? Really, what is your say?
I have good experience of children, my own children, going to schools the age Benjamin is teaching secondary school, so they've all gone past that. But I appreciate and I can relate to the situation he has described in the laboratories in the secondary schools. But I think he has actually raised very practical issues, and he has raised all the questions which we have to address as schools reopen, as we hope we can send kids back to school. But among those many questions, he has actually one part solution. He suggested the shift system, because the biggest thing that will hit the schools is this: we still are not rid of COVID. We still haven't got a vaccine. So important public health guidelines remain in place, like social distancing. So when kids go back to school, they will have to continue social distancing. That makes the capacity of schools to cater for all these kids the single biggest problem, for which they haven't got a solution. So actually thinking about a shift system may just begin to address that. And when he suggested a shift system, I was smiling to myself, because I was thinking, yes, they're going to have to give it a Sudanese solution. Because I remember how our primary schools used to go, like in Lower, there will be the morning shift and the afternoon shift. So these classrooms can be shared. You literally have two shifts. But important changes have got to be brought to bear, which like Western communities are not familiar with. Our communities are much more familiar with this. You can send kids to school, but they don't have meals at school. They have their meals at home. And most people used to come from either schools or their offices to have lunch at home and go back. So if you turn that arrangement on its head and you think of, let's say in the UK setup, that you send kids to a school in two shifts. The first shift, go to school and come back to eat at home. And then the next shift, it's at home, then go to school in the afternoon. And they don't have to go to the dining hall. They don't go to the playing ground. And some of those shared resources like lockers will be less used. So you actually have an opportunity to minimally go to school on a shift system, but allow only classroom contact hours, so that the school's capacity can quite easily be doubled doing things that way. And that is a very important thing, because here the unfortunate thing is that kids don't go to school and come back on their own. It impacts on the work uh, life cycle of their parents. So in many ways, it is probably fortunate that some parents, and hopefully many of them, will continue to work from home. In those situations, parents should be given the freedom to leave the house at least once or twice to maybe pick kids from school, those that cannot, those that have got very young kids. So these are very practical things that we could actually address. And in fact, I think the way in which he has described the classroom, some of the solutions, which you might think of as, we used to have two shifts in this primary school in Law, because we are a poor country. We can't afford two schools. But funny thing is, actually, in these very advanced countries, when we're hit by a problem like this, because we don't know when COVID will leave us, we have to be very practical. We need a certain minimum of contact hours between teachers and kids. Otherwise, they will fall well behind. Now, over the last 3 months or so, because of lockdown, most parents had to homeschool. Now, homeschooling can come in very, very many forms. Homeschooling can be just going online looking for interesting material. But homeschooling can also be very structured, so that you teach material given to you. Or homeschooling can be actually much more structured, like the universities had to do, which will be online. You have your normal lectures, you have your normal classes, but online. Now that can be done in the developed country, but even in these developed countries, there is a huge chasm between those who have got a well set up Wi-Fi and online access in their homes, and those who just about can make it. So after 3 months, even with the purported online learning, as kids come back to school, there is a huge difference. There is a deficit between those who have had the best provisions at home and could learn anytime, and those kids from poorer families who just had very little opportunity. So there's a big gap. There is a deficit. We should be careful that as they come back to school, however well the school is structured to take them back, the kids don't come back equivalent. They have had a difference in how much they kept up with learning. So those are important things we should relate to. I don't know how we will address them. There is an even bigger thing to do with with schools. And I think when you look back at home, I think of both Southern Sudan and Uganda as similar. But I take Uganda as example. I know that over time, after the wars, we've got great schools in Uganda. A lot of people in Southern Sudan, actually, the senior people, some of them went to school in Uganda. Increasingly, you've got the best schools can be the private schools, because there's a lot of, the education sector is an industry in its own right. So there's a lot of money going into education. a lot of good schools, you pay for that. But because of the lockdown, there is a different dynamic where, because those free schools, rather the private schools have got those freedoms, if the economic impact on the schools is too much, they simply lay off their staff. And then these great schools, when they crumple because of the economic effects of shocks of COVID, I don't know who will put them back together again, because these are some of our best schools. Some of our best teachers go and teach there. And if such people are laid off, there is a catastrophe in the community. So there are many ways in which we look at this education or going back to school. Wonderful thing, we want to do it. But what capacity have we got to take the kids back? What differences have we come to realize in kids going? Because when they were at home for 3 months, there was no equivalence in how much they were learning. What about the private sector? What about the layoffs, which are coming fast and thick? Because there will be a lot of private schools that need the return, the financial return for the education they're offering. If they can't, what happens to those very good schools? What happens to the best teachers who actually opted to go into private schools because they pay well, because they train some of the best kids in the country? So there are many other aspects like that, which I think we've got to think about. It's good for the government to decide lockdown or reopening, but a lot of us parents will have to pick up the pieces as we go along. I will comment
I
about
totally do agree with you. I've also been thinking about. Sorry. Yeah. I've also been thinking about boarding schools. You know, we have boarding schools like we in South Sudan. We benefit a lot from sending our children to Uganda in boarding schools. So you know, there is indeed a lot that needs to be done by the government, by the parents, by the schools, and you know, as a teacher, I know I can understand if Benjamin says that there are a lot of things that need to be put in place. I wouldn't imagine myself going out and teaching because, you know, now you have to be very cautious, you know, and you have to be able to quickly tell when a child is not feeling well, they've got, you know, maybe headache, they came with a headache. In certain offices now, before you step into the office, your temperature is checked to be sure that, you know, you don't have any temperature. And if you do, you're sent home. I don't know if the schools are going to introduce such facilities or if the children are just going to walk into the schools like they normally do. And if they just walk into the schools, at what point will the teacher know that, you know, that child might not be feeling well, needs to be sent back home? And if the child normally goes to the place after school, you know, some children they go to after school because their parents have to go to work. Unless the parents organize organize it in a way that they work from home. Otherwise, they have to be picked and taken to the play group. So, and in the play group, things also have to be organized. You know, the social distancing have to be introduced. So there's a lot. It's a chain of things that have to be put in place before the children can return to school. I'd like to hear from you, Rodrigo. What's your take?
First of all, thank you. I find this discussion a little bit more interesting in a way that from the two discussants, in my own view, I still feel the element of fear is still deeply rooted in the minds of parents, in the minds of people out there. A few weeks ago, pronouncements made by the World Health Organization in relation to COVID and social distance is that the decisions made of how people can relate and associate the decision between life and death. Just like Ferdinand mentioned, the COVID is not over yet. We are still trying to struggle with the situation. There is fear of the second wave. So the question of safety is not still guaranteed. Unfortunately, all systems in relation to governance is still highly politicized. If you take example of the reopening of schools, it's all about politics, it's political. Take an example of what is happening in the US. To those in power, opening schools and setting work schedules to run normally, it is a choice between life and death. But to their advantage, they will think that things are working on normally, and yet it may not be the case. So really, I would think it's still too early for us to quickly say that the school should be open. I would think we still think of a way of trying to find means of supporting our own children from homes. I know it might be a very difficult situation. Just like you said, it starts right from the entry. How safe are the children? And yet these kids come from various homes. How safe are the teachers? Children will always remain children. Even if we talk about social distancing, like you are talking about on arrival, testing body temperatures. I'm not a medical doctor, but I would still fear testing someone's body temperature alone would guarantee safety of an individual. I had a chat with some few teachers from Uganda, for example, as to whether they would deem it safe to have schools reopened. And many are in the view that it is still too early because there is fear of a lot of unknowns, just like what Benjamin has been clearly outlining, issues related to social distancing. So I think the question will still come back to the question as to whether these governments who are trying to enforce will get it right or wrong. Assuming they get it wrong, what might be a total disaster? It might even be a catastrophe. Because now try to imagine children, however much we may try to implement the social distancing, coming from various homes, getting together. So you can see how fast and how the virus will spread if at all the government gets it wrong. So, on my personal view, I would really think it is choice between life and death. So the COVID is still with us. There's still a lot of unknowns. So I would really think the speed should slow down. There was a government pronouncement by the government of Uganda. The government was thinking of which section should be opened or which one should still wait. There was an idea that maybe those students who are bound to finish their levels, like primary 7, or maybe those candidate classes, probably should reopen, so that it will give them enough, space and occupy the other classrooms, so that they could be apportioned into various classes and help them to go to the next stage, while the other sections would continue being supported from home. Even here in the UK, I've come across certain parents whom I hear are able to teach their children from home up to a level where they would go and sit exams. I'm sure Benjamin might be able to maybe throw more light on that. But at least something really needs to be thought deeply into it. But personally, I am afraid in relation to the views I've got from other teachers, just from within and also in Africa, they are like, I think there's a need for the government to go slowly. Let us not go into full blown up opening of schools, because should we get it wrong, we may not be able to quickly contain the situation, or we might be leading to a disaster.
I do agree. We don't know because it's a two-coin thing. We might get it wrong or we might get it right. If we get it right, we're happy. If we got it wrong, you know, then that's life we're dealing with. I think Benjamin and Ferdinand made a very important point that maybe shifts, we could introduce shifts like we're having in Africa, that we'll have an evening morning section coming and an evening coming, but that would then mean that we need more resources, or like what Rodrigo said, maybe we could do online teaching. Maybe some children would want to learn online, because now the decision is children who are a little bit bigger, even if they are told to grow to school, they might not be interested. Like I remember before the lockdown, my son was resisting going to school, and I'm like, but you are in the final year, you need to go. But he says, Mommy, I've been reading all over the internet, it's so safe to go to school. So even if even if the government says every child should come back to school, now they can read for themselves. They can find out the impact of coronavirus. So some of them might say no to their parents. So we are in a situation of the unknown. We don't know. But I'd like to hear from you, Benjamin. Do you think that all the children, the 30 children you've been talking about, do you think all of them will come back to school, or some of them, would opt to learn from home? So then we might even have 20 in the class instead of the 30.
Well, the issue of learning from home is, I mean, generally, a lot of children learn from home during school days. They do the homework from home, do extra studies from home. That happens. Now, if children learn from home, there will be no homework. Because they're already doing that at the home.
There will only be homework.
Yeah, because children they've got this mindset.
to the children.
I know generally a lot of children are not fan of homework. But homework is very important. It helps. Now, even if they do that, you can understand the quality of the learning. For example, in science, they can't do the practical work.
Mhm.
I
Have we lost him?
think there's a network problem.
He's frozen.
I think picking
Mhm.
from what Benjamin has been saying, picking from what Benjamin has just said, I would really think that let's agree that we are in a very difficult situation. Let's cut our shoes according to our size. We are in a crisis, and I think if we are in the expectation of the best ever, like we had before, we are making a mistake. I would really think let's go by the situation. Let's do the needful we can instead of dreaming of doing the best we have been doing before in relation to the current situation. Personally, I would still fear to send my children to school. Even if I was a teacher, definitely I will have that fear of what I don't know that I might bring home to my family from school, because I'm going into a situation whereby I'll be interacting with many other people. Even in universities, for example, where I am in Sheffield, I had an interaction with one of the lecturers here, and the lecturer was really, really feeling low and down because of her previous interactions with the students. But the truth is, The fear is still there. Now, like we have been talking about the number of children in classes in developed nations like United Kingdom, we have like 25 children in a classroom. Let's have a reflection of back home where we have hundreds. Look at our university. Remember those periods where even if you go to attend lectures, you might be attending lectures from the window because the lecture room is full. So it's going to be a very a very big situation. So I would really think we should not dream too big. Let's cut the shoes according to our size. Let's work on the subjects which we are able to support our children with, and then we will let what we are unable to sort out take its course. You may never know. The COVID situation might come to an end soon or later. That is what I really think of.
I'm thinking, what we could do is, even if the children are to learn from home, like because they normally go to school 5 days a week for 6 hours, so they could divide the children up into sessions so that they come once a week because as Benjamin was saying, we don't know if they are covering the topics they're supposed, the quality of work. Is it good quality they're producing, or they're just sitting in front of the computer saying they are learning and they are not? So really to be able to check that, what could happen is we could allow the students to come in once a week, maybe for 2 hours. We could reduce the number that come in, and then maybe instead of the 30, we could have 15 coming once a week, and we check their work and they go home, instead of them coming every day. That way we could limit the number of people coming. But of course, as you said, Rodrigo, we don't limit the exposure of the teachers because they have to come in every day. And you said you don't, as a teacher, you don't know what you're taking home to your family. But we've got to do what we got to do, don't you? Benjamin, what do you think?
Yeah, I was just, I think my network was interrupted. Yeah, the point there of quality of work is very important, because most learning has got to be assessed at a standard level, so that children are learning what is expected of them. During this lockdown period, the quality of work, I'm sure, has gone down. And that I could see from my own kids, because of the lack of support. Now, the issue of safety Rodrigo is talking about, it's very important, because if people go to school, the way they go to school is they follow a path. They go on the footpath along to the school. Now, as far as I know, how viruses move about, they don't walk as people walk. They don't keep social distancing. They are carried by the wind. So supposing one of the kids is in contact and has already left a stream of virus on the way in the air, so the other kids would have to pick it up. So really, really, really very difficult, that situation. Now, the point is really to avoid people getting into contact with the virus. That's what Lorica's point is. That's very important. How people are going to do that, I think the government needs to think deep, and the issue of testing is key. And I can see already now the lockdown has been eased. People are trying to move freely while the virus are not gone yet. Who can tell how far the virus have gone? if the number of people infected is getting down, does not mean the amount of virus is getting down. It is just that the virus is not getting in contact with the people. So we need to be very, very careful there. The government really needs to make sure to know the number of the virus in the air. If they do not know the number of virus in the air, they shouldn't be complacent. You know? So the very, very key things here is, what are we going to do to ensure that the learning is taking place and children are not exposed, including the staff, the COVID-19? That is the very important thing. I cannot tell how they can do that, but that is the part that we really, really need to do. If we can't be sure about that, Rodrigo, as you were saying, that scaremongering or the fear factor there will become justifiable.
I do agree. Thank you so much. We are now more than halfway during our show.
So for our children, I think parents have got to take the issue number one very seriously themselves. How they can educate their kids to follow the policies that are laid down, so the children follow it strictly, and they parents do it the same. And that means the system the government puts in place has got to be credible one. Now, if you find one government officials traveling from one place to another, for example, here, and people are not supposed to travel from one place to another, and they're doing that, and they expect children to do the opposite, it's not going to work. Everybody has got to do what has been set down. That is my point. I mean, in short, consistency.
There's one thing I wanted to.
I'll come to you, Gregor. I just want to announce that, we are left with 15 minutes for our show. So just to remind our audience there, so that they don't, we don't take them by shock that, we finished. You can go on. Go on, Rodrigo. Thank you.
Yeah, I just want to add that the question of children going back to school, I hope, is not coming from the fact that there is a belief that young people are less prone to COVID-19. Because recently there is a pronouncement by World Health Organization that even children are prone to COVID-19. So let's not think that, let people out there not think that children may not be more vulnerable, because let's not learn by experience, because if we have that in mind, we are going to put our own children into a very big risk, and yet these children are supposed to be the future leaders of tomorrow. So really, really, we need to be a little bit more conscious and more careful so that we don't make a mistake. Like I said earlier on, personally, if I was a teacher, I am not a teacher, even as a parent, I still fear. If my child goes to school today and comes back home, the question is, are we safe? And I'm sure even Benjamin, who is a teacher, if you are asked to go to school, to go and teach on a daily basis, even if not on a daily basis, for you to get COVID, you don't have to really be in a particular place on a daily basis, but even an interaction once, even for a few hours, you can easily become a victim. So that is my result.
That point is very important. Just not to interrupt. If children are less prone to the infection, it doesn't mean they will not be carriers.
Exactly.
So if
Very
they are
true.
carrying agent, they can transfer that to people who are who can easily be affected by the coronavirus. So that thing is very important there. So
Mm.
everybody is in the same danger.
I do
Can I say
agree. I
something?
do agree. Yeah, go on, Ferdinand.
Yes, I want to comment to the points made both by Benjamin and Rodrigo in tandem. I think the issue about reopening schools, especially when Benjamin first said, how do we know that when the kids are going to school, they will not cross-infect each other? That's very important because opening schools is not about how social distancing is maintained in the school. The school can do all the right things, but the kids getting to school is the risk. So it's not schools in the playground, within the confines of the school, but school as a totality of somebody leaving home to go to school. Things happen along the way. If they were not going to school, it would not have happened. That's the first important thing. The second thing is whether we've been lulled into the belief that children are not uh, uh, susceptible to this COVID-19, so it is okay to send them to school. Well, you can send them to school, the children, even if that were true, they're taught by adults. And the funny thing is actually, much as it's said, children do not succumb, whatever term people use, it is true that children don't suffer this disease as badly as adults, but they actually do carry the disease. They can get infected and they can transfer it. That is actually now reasonably understood. So the idea that you will never see a child in bed because of COVID, but you will probably see the grandparent or the parents or elderly people around them that they've managed to infect. That is a possibility that we should never fool ourselves in by not believing. So the risks increase, not only that the kids on their way can get infected, but the kids can become the so-called super spreader. So all of these activities associated with going back to school should be seen and assessed for the risks that they bring back to the population. So if we're fearing a second phase, maybe reopening schools may be just one of those things because they become the asymptomatic so-called transmitters, because these are people who have got the disease but they don't have the symptoms. A lot of grown-ups, a lot of adults also who are healthy actually have this disease. They don't know they have it because they cope well with it. The kind of, even those who have got the mild one can shake it off. So we have to be very careful. We have to factor all of those things. The last thing I wanted to say is this: we're talking about lockdown. In every country, people talk of lockdown. In every country, people talk of reopening schools. But we must understand the peculiarities of these various countries. And even within countries, the various communities and districts, because for cultural or other reasons, the way in which the disease will spread between communities and in certain countries will be so different. We have the case of the truck drivers, we have the case of the worshippers, we have the case of the people singing in a choir, we have the case of people going to funerals. In every community, in every nation, there's sort of events, and you should think of them as events or activities that cause the spread will be very distinct. So we should respond to those things when we either lock down or reopen schools, because in many ways, transmission is from person to person. But if you socially isolate, there will be no transmission. But when there's no social isolation and we can't social isolate forever, you should think of the activities that people are involved with or events like going to a big show, going to a concert. Those are the sort of situations where it is very easy to spread. So how long we'll be wearing masks or social distancing, I don't know. But in every case where we're taking a local decision or national decision, we should attend to the peculiar activities of our community, and then we will get it right. Or if not, nearly as good as we can do. That's my few comments.
Yeah, I do agree. We don't know how long we should wear masks for, but I think it will be as long as we don't have the medication or vaccines to treat this coronavirus. Uh, the right thing has keep on changing because this is a very new virus. People don't know about it. Today, one point is right. Tomorrow, they discovered something and they say, oh, it's not this, it is that. Now we know they say children are carriers, and some people, they have very strong blood in a layman's term. So it means that they could be having the virus, but they won't be transmitting the disease. But they are as dangerous as those people who are actually having the disease and they are in the hospital. because they can infect other people. So the question still remains, as parents, as teachers, what do we do? Is there anything we can do? I don't know if there is a board that is set whereby parents with teachers to discuss. Because as a parent, I'm so scared for my son to go out. I would rather he learn from home, but he can't because he needs the lab. The course he's taking needs the lab. He needs to be a lot of times in the lab to try this and try that and try that. But the fear is now I'm fighting between, should he lose 1 year in his education or should he continue? We are fearing the gap, the educational gap. We're saying there's a gap. Should we accept that gap or should we let it go on? Or should we, what should we do? Go on, Dali.
One last comment, Chair, if you don't mind. One last comment quickly. I meant to say this to Benjamin. I think he talked about the need to go to the lab. I think we should begin to be smarter and think about possible return to school in a very smart way. We should think in terms of essential contact hours, and that is definitely there for something like laboratory work, probably not for a history lesson. And you can think imaginatively of how people in Australia used to teach kids by radio. You should think about the wonderful open university programs where people used to learn on television and then have a few contact hours every 3 months. And then we should think about how BBC these days has got that program called Bite Size, which can go all around the world and kids can learn such a lot without needing to be physically at school. I thought I should just bring that forward. Parents may be able to take it on.
I think
Thank you.
briefly, what I can say is when we talk about schools, we need to also analyze the various categories, various stages. Is it a primary school? Is it a nursery? Is it a secondary? Is it a university? All this. So I would really think if there's need, we must go in stages and smartly, not randomly. Because a few days ago, I've come across some children carrying this kind of masks, wearing it. But when I looked, when I saw the masks they're actually wearing, you can clearly tell that the mask had dropped down on several occasions, so dirty, and they still continue. It's like they will pick it from down and put it back. So it could even be a source of more reinfection, let alone the COVID alone. So it is like sometimes we may be thinking like we are trying to prevent, but we might be finding ourselves making matters worse. So really, maybe if there is still a high level of need, I would advocate for maybe the upper school in stages to start, and then we learn from it, other than involving all from a probably nursery, primary, secondary, and whatever you. So to me, that kind of smart and systematic approach needs to be started with maybe universities, and we see how they're going to cope. Because to be honest, like we even had our leaders, we are often in the beginning we are saying, well, let's wash our hands often, let's avoid touching our eyes and nose, but we find that some of these actions come in a way of reflex action. You find that you've done it. Even shaking hands, sometimes you find that you did it. So it is like embedded in our past humane lifestyle. So gradually, it will take time. So I would really conclude by saying, let's be conscious. Like Dr. Ferdinand Lally said, COVID-19 is still with us. So we need to be extra careful.
Thank you so much. I would ask your comments, Benjamin, but before I ask, I totally agree with what the two have said, Rodrigo and Ferdinand. The virus is here with us. We're still learning about the virus. We haven't completely learned about the virus. And the measures that we are putting in place, it's just a small measure. We could do all we can do from our side as the school, but we don't know what happens outside the school. And I also want to add that even in the school, the child going to the loo or to the bathroom would open the handle of the loo, and another one will come and handle it. Touch it. Yes, they would wash their hands when they're coming out, but when they're going in, they are touching the same door. Even in the classroom, from class to class, they are touching. Maybe if the doors are all open, yeah, to limit the touching. I remember in the church before the lockdown, what happened was all the doors of the church were left open. The blessing water was removed. You just walk in, and hugging and greeting was stopped. But still, that was a limited measure. It is not complete until it was decided that now it's complete lockdown, no coming to church. Those are the things that were happening. But that was within the church premises. Outside is not the same. So it's the same with the school. The teachers can do everything they can do, but they can get the cleaners to clean each time any room is used, the lab is used, they can clean it. But really, what is your last word, Mr. Benjamin? You think we can safely send our children back to school? You are a teacher and a parent as well. What is your last comments to us before we round up?
Yeah. There's one important thing for children in school is they are there to learn and to get quality education. And the access of learning has got to be for every child. The opportunity must be there. For those who may not access the learning properly, as much as the others can do, they need support. Now, the level of support from learning from home will vary from a child to a child. So we cannot tell if all these children have got equal learning support from home. Now, if they are not getting the minimum support from home, then this thing disadvantages a good number of children. And that becomes unfair by not intention because of the circumstance at home. Our homes are not the same. Where children live, they are not all the same. Some parents are supportive, some are not. Some of them got resources to support their children, some do not. So it is really, for me, the term of equality is going to go into question. The terms of equal access to learning is going to go out of control. And if that becomes the case, we are educating children at a different standards. So that is something I believe government and the teachers need to take into consideration before they can decide what is the best way to do. I think I need to highlight that. Yeah.
Mhm. Thank you very much. Thank you, everybody who has been on the show. That's all we have time for today. As you can hear, it's a mixed feeling. I will conclude that it's a mixed feeling whether we should send our children to school or not. Our teacher has told us the importance of going back to school because it sets a standard for the children because they are being watched. What they have learned is being watched, and also it's easier for the teacher to tell whether the child more help. So really the message we should take home today is nobody is very sure or confident whether to send their children to school or not, but we do understand as parents that the importance of learning, but we need the government to look into this matter very seriously, and even the very simple things they should look into it before they can open the schools for everybody, because for every child, I mean, because children would be bringing these diseases to their parents and their elderly grandparents or whoever is living with them at home. Thank you very much, everybody, for attending the show. We'll be back in 2 weeks' time. Thank you. Bye-bye.
Bye-bye. Bye.
Bye-bye.
Bye.
Take the recording out. You are